Hello, I'm Jennifer Martin, your host for today's show. Welcome to Franklin County Home Health Agency's Where the Heart Is. Franklin County Home Health Agency is a nonprofit home health care organization that has been serving the 15 cities and towns of Franklin County for the past 4 decades. We are proud to bring you this monthly show to give you information about the agency's programs and services, as well as helpful tips to help you stay safe and healthy at home. Town Meeting Day is just around the corner, and today we'll be talking about town meeting and the support that the agency receives from town voters. And with me to talk about that today are 3 members from the agency's board of directors. I have with me Hank Lambert, Bridget Horrigan-Rivette, who is our vice chair, and Michael Gahn. And thank you each for being here today, taking the time on this cold February day to come and warm up under the lights. If we could just introduce yourself again and tell me something about yourself, your experience in Franklin County, the work you do, and then what brought you to volunteer for Franklin County Home Health Agency.
Well, I've been with the Franklin County Home Health Agency as a hospice volunteer for the last 3 years, and prior to that I did some hospice work for VNA in Chittenden County for about 10 years. So I really enjoy hospice work. It's rewarding, and I know people like it. I live in Swanton. I grew up in Highgate, and just like the idea of being with people, with families when there's a time of need. So.
Thank you, Hank. And Bridget?
Hi, I'm Bridget Horrigan-Rivette, and I actually grew up in Fairfield and then was gone for many years pursuing, college and grad school, and had a long career in the healthcare insurance industry. When my husband and I retired back to Franklin County is when I was introduced to Franklin County Home Health. My dad was sick and did die, and the fortunate part there was I was introduced to some of the angels of Franklin County Home Health. And that really sparked my interest to be more engaged. Being in the healthcare insurance industry, I understand and really support the role that home health plays in the whole continuum of care, and was really delighted when I was contacted to be a member of the board.
Thank you. Yeah. We're glad to have you. And Michael?
I'm Michael Gahn. I'm an attorney here in St. Albans. I practice with the firm of Cahill, Gahn, Miller, and Manahan. I am one of the city reps on the Board of Home Health. I originally came into home health back in the 1970s when I first arrived in St. Albans from law school. And at that point in time, my wife and I did take the childbirthing class that was offered by Home Health. More recently, back in the mid-1990s, my dad came to live with us for a period of time, and while he was with us, we did receive home health services.
It's what a good reflection of the work that home health does. All of you have a different experience and a personal experience, and like Michael said, he's the city representative. So on the board of directors, tell us how many folks are volunteering and how they represent each of the cities and towns.
Yes, I mean each town has a representative on the board. I think the city has 3. There's Kathy Keenan, Gail Albertelli, and myself. And I'm not sure how the other municipalities fit in, whether they just have one or whether there's more than one. I suspect that there may be people that have a particular point of view. So for instance, myself, I'm an attorney, so it may be that what I'm able to offer to the board is more than just being a city resident, is that I have some sort of occupational...
a lot of talents there on the board.
Yeah, something that I can add.
Yes, right. Thank you.
And at this point in time, there's multiple folks on the board from the town of Fairfield. Stephen Doe is on, and he's representing, the assisted living in that whole discipline. And then Daniel is on, and he has a lot of technology background working in the hospital system. So, like Mike said, I think it's a nice cross-section and diversity of occupational expertise and representing the towns around the county.
And some good history there. You've been with us before in the past and then came back.
A while back.
Yeah, in the early days. So you've seen how home health has changed through the years and how it's grown.
Well, actually, when I was first on the board, we had our monthly meetings downstairs.
Yeah.
And it was shortly after that they bought a house on North Main Street.
Right. Yes, we've had a lot of locations.
And that was, but I was off the board by the time I think that happened.
Yeah. Yeah, there's been a lot of locations, and we should mention that the agency has the main office in St. Albans and then a satellite office in Enosburg, so that we can better reach all of the many areas that we serve. And that's what we're here talking about today is there's many ways to support the work of home health. One by volunteering, like through hospice, or volunteering on your talents on our board of directors, or donating through our memorials, and many different ways to support. But the agency also receives support from our towns. So if we could just, Michael, if you would give us a brief history about the funding that the agency receives from towns.
Well, I was actually going to do it a little bit differently.
Okay,
Is
sure.
that historically, if you go back to the beginning of time here in Vermont, back in 1797, there was a law that was passed that indicated that every town shall relieve and support all poor and indigent persons settled lawfully therein whenever they shall stand in need thereof. And back then is that you actually, when you moved into town, you didn't become a resident automatically. You had to be asked, or at least not asked, to leave. And so, for instance, in my family, I'm related to the Sanborns, and the Sanborns were over in Lyndonville area, and they were technically warned out. They were told that if you should become poor and indigent, don't rely on us. But if you were able to manage to stay within the town for at least a year, and were not given that invitation to leave, is that you became a resident, and as a resident, the town was under an obligation to support you. And so that if you go back historically in time, is that here in Franklin County, the support, if you became indigent, is I think there was a contract among the municipalities whereby they'd say, okay, we're going to give you a place to live. You're going to move to Sheldon and live in the poor farm. But the municipality would pay to the town of Sheldon the tuition, if you will, the room and board for putting you there, and part of what you were given is to make sure that you were given health care access. Obviously, that system was abandoned at some point in time. Back in 1896, the legislature passed a law saying that municipalities shall engage a public health nurse, and so that particular role was now, we got rid of the poor farm, and I don't know when was the last time the poor farm was actually had a resident.
I don't know.
But got rid of the poor farm, and you started having more community-based services. And I think that with the passage of Social Security, Medicare, ANFC, and various other social service programs, those activities that had been supported by the town started being supported by the state or the federal government. Nonetheless, is that at some point there are still people falling through the cracks, and those people that fall through the cracks at the federal level or the state level still need to get medical services. And eventually, home health came into being just because there were more people needing services than the public health nurse for each municipality could provide.
Fill that need there as the need grew.
Yep.
Certainly. Good background. Thank you for sharing that with us. It's amazing the history that's here, and that desire, though, that still remains strong, that to take care of everybody regardless of their abilities, and that's what we're here to do, and why we rely on this town's support. So talk about the towns and the cities currently and how they support the agency.
Well, Fairfield traditionally has had a specific article on the warning for the town meeting about donating funds to the Franklin County Home Health. And Fairfield is one of the towns that has held on to the town meeting day to discuss the various articles that are warned and the various funding questions that are in front of us. So we will be meeting on Tuesday, March 4th at the school hall, and we'll execute against the warning. And Fairfield traditionally has been very, very supportive of Franklin County Home Health, and typically when that article comes up for discussion, it's a pretty easy discussion, if you will. Someone typically stands up, expresses their support and gratitude for the organization, and the funding is passed.
So how do we answer folks when they do say, though, why do you need to ask? You mentioned Medicare and Medicaid. Talk about the funding that the agency receives and why we need to fill in that gap.
Well, before we get into that, I was just going to add, as far as the city goes, the city doesn't have a typical town meeting. You may be able to go to some sort of informational meeting at some point in time, but there is no town meeting where everybody gets together. What's happened in the city is that historically, home health and other social service agencies were put on to either into the city budget or were given an opportunity to be added to the city budget through an article in the warning. And the city did that automatically. They would say, we'll put in whoever wants to be put in. Back in 1999, the city was having trouble passing its budgets, and it felt that it was competing with its social service agencies for tax dollars. And so I think that I know they cut home health off. I think they cut off almost all social service agencies. And so since 1999, the city, and the city only, has not been contributing to home health.
And talk about the care that's provided in the city.
Well, I'm happy to do that. I've received some documentation from Janet when we presented our petitions to the City Council. We are going to be on the ballot this year. Here in the city, and I apologize, I'm not
That's okay. So all of these
familiar
numbers
with
going
it.
through our heads.
So in the city of St. Albans, in 2013, there were 282 people who received visits. That represented 18.2% of the people in Franklin County who received home health services. 18.2% of those people were city residents. If you were to do that by the number of visits, that 26.4% of the visits were made here in the city of St. Albans, and numerically that amounted to 20,031 visits were made here in the city of St. Albans by various personnel, nurses, physical therapists, occupational therapists, speech therapists that were provided by home health.
Right. So it's a large chunk of our clientele and the work that we do.
It's in excess of 1/4.
Yeah, exactly. So that's very important, and that's why we thank you for the work you've done to help get that back on the ballot, and I appreciate that. What are some other ways that the agency fills this gap, the funding?
Well, one of the things is the Blue Jean Ball, which is the planning is getting underway. That's held this year on October 25th, and it's a lot of fun. It's a delicious meal. There's dancing. There's a silent auction, and it's one of our major fundraisers. In addition to that, there's an annual appeal that goes out to county residents asking for donations, and many people decide to give in memory of a loved one that has died. So that's a good way to support the agency and still keep the memory of that person alive. So those are ways that, and we're always looking for new ways to fill the gap. There's always a gap. There were over 76,000 visits in 2013 by the staff, the nurses, the LPNs, the volunteers. Over 76,000 visits to almost 1,600 people. So it's quite a legacy, and it's a wonderful organization to be part of, and to see the effect that it has on providing good health care and quality of life to people. So it's wonderful.
Thank you.
Yeah, and the thing I would add is, the mission of Franklin County Home Health is about, providing high quality care for anyone that needs that care, regardless of their ability to pay. And the agency does that through the, 76,000 visits to, 1,600 folks and such. And there's a lot of reimbursement through Medicaid, Medicare, and then the commercial insurers, but there's still a gap between the reimbursement, and the gap last year was $450,000, and that's where we look to the funding from the towns, the Blue Jean Ball, the various charitable donations from folks to help cover that gap.
Okay. And we should mention that all these people, that's people from, as you mentioned, whether it's childbirth education through
Right.
A mom coming home with a newborn, people of all ages receiving care right after a hospital, to those who are terminally ill and dying. So it's people of all ages that there's always going to be a need.
Yeah.
And we're trying to, as you said, the funding that we receive just cannot cover it all. So it's so important that we have this
And I
extra support.
think it's important to note that Franklin County Home Health is a nonprofit organization, and so we're not allowed to make a profit. And as a result, if you don't have funding from someplace, is that you end up going in the hole. And it's been a difficult few years.
Yeah, and talk about that system in Vermont of the nonprofits, a little bit about that. That the agency, we have sister agencies that you mentioned you've been a part of volunteering at one of the VNAs.
VNA, yeah.
And so that's, it's important in Vermont that we continue that legacy. As you said, there's a lot of history here, and that legacy of providing care regardless of the person's ability to pay.
So you have the people that are receiving Medicare, you have the people that are receiving Medicaid, you have the people that are have private pay insurance, and then you have the group of people that don't have private pay insurance or don't qualify for Medicare or for Medicaid, and they either pay out of their own pocket, but many of those people, the reason why they don't have private insurance is they can't afford it, and if they can't afford private insurance, they probably can't afford to pay private pay for nursing care, and those are the people for whom we are really asking contributions from each of the municipalities to say that we are taking over a role that historically you, the community, have had a responsibility to provide.
Well put.
And you, the only thing I would add is, when you think about those numbers and try to put them in context, it's like from a personal level, you don't have to go very far into family and friends to find someone that has, been a client and a